there, I'm Tiffany Wuebben, and I'm so excited to have you here with me today. We're digging into a topic that underpins everything we do in dentistry, educating our patients on oral health. Now, we all know knowledge is power, right? Well, the more patients understand about the oral health, the better equipped they are to make good decisions and maintain those healthy, happy smiles for life. By the time we finish today, you'll have strategies to make patient education a seamless and impactful part of your care. All right, so why is patient education so important? Think about this. Most patients only see us a few times a year. That means for the majority of the time, they're managing their oral health all on their own. Without proper knowledge, they might not floss regularly, spot warning signs, or even understand how their habits affect their teeth and gums. Educating patients bridges that gap. It empowers them to take control of their oral health, reduces the risk of bigger problems down the road, and strengthens the trust they have in you as their provider. Now, how do we make patient education stick? First and foremost, you have to meet patients where they are. Everyone's knowledge level is different, so start by asking a few simple, open-ended questions. For instance, what's your current oral care routine like? Or what do you know about gum health and affecting your overall body health? This not only gives you a sense of their baseline, but also invites them into the conversation rather than just being recipients of the information. Once you know where they're starting, you can tailor your message, and trust me, personalization is key. A highly active athlete with lots of energy drinks will need different advice than a patient struggling with diabetes or gum sensitivity. For example, instead of just saying, you need to reduce sugar, you could explain how their specific habits are leading to plaque buildup and cavities, and then offer practical swaps. Tailored advice resonates because it feels relevant. Now here's where it gets visual, literally. Studies show that people tend to remember what they see far more than what they hear. Visual aids can be a game changer for explaining complex topics. Use tools like intraoral cameras to show plaque buildup, handheld mirrors to point out gum inflammation, or digital illustrations to break down treatment plans. For younger patients, fun, colorful diagrams showing good versus bad food choices can make the learning process engaging and interactive. The goal is to make it clear and relatable. Another effective strategy, demonstrations. You know we've all done this at some point, picked up a toothbrush to show someone step by step how to brush at the gum line. These little demos can leave lasting impressions. Similarly, showing how to floss properly with a model or even recording a short video for a patient who's struggling can make a big difference. And don't forget to ask them to show you what they've learned. Interactive learning boosts retention and gives you a chance to perfect their technique. But education doesn't stop in the chair. Providing handouts, tutorial videos, or even links to resources they can reference at home is a great way to reinforce what you've discussed. A lot of patients forget what they've learned as soon as they leave the office. It's human nature. A brochure about preventing decay or a text message with a link to a video on caring for their crowns can help education go a super long way, well after the appointment is over. Now, I know not every patient loves the idea of sitting through an oral health lesson, but that's where your delivery matters. Keep it conversational and empowering. Instead of a lecture, focus on the why behind your recommendations. Instead of you need to floss because you're not doing it enough, try flossing daily could lower your risk of gum disease significantly, and that help keeps your teeth strong and healthy for years to come. Notice the difference? It's small, but there is a difference there. One feels like homework, the other feels like an achievable way to take charge of their oral health. And speaking of empowerment, be sure to celebrate your patients' successes. If they come back with healthier gums, or they're very proud in telling you that they're flossing daily, take a moment to acknowledge their efforts. A simple, wow, your gums are looking healthier, great job, can motivate them to keep going. It's about creating a partnership, not just offering instructions. Before we wrap things up, here's a quick summary of how to make patient education impactful. First, tailor your educational efforts to each individual. Ask questions to gauge their needs, then customize your advice so it feels relevant. Second, use visual aids and demonstrations to make concepts easy to understand and memorable. Third, provide resources they can reference at home to reinforce their learning. And finally, keep it conversational and empowering. And don't forget to cheer on the progress that they've gotten to along the way. Here's a challenge for you. Pick one area of patient education to hone in on. Maybe it's preventive care, dietary habits, or post-treatment instruction. Test out a new visual aid, practice rephrasing your advice, and see what happens. Small tweaks in how you communicate can lead to big changes in how patients engage for their own health, for sure. Make it a great day. Keep striving. You're doing wonderful. I'll see you at the next session.